I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you to Healthcare Now for having me. It is great to be with you at your annual Medicare for All National Strategy Conference. This group has known for a very long time that America's healthcare system is broken, that it is more of a sick care system. And in the richest country in the world, it is criminal that 85 million Americans are uninsured or underinsured, and that 1 in 3 Americans has medical debt totaling $220 billion, all while the top 5 private insurance companies have pocketed $370 billion in profits over the last decade. Whatever it was before, even the healthcare that we have now is being decimated by the Trump administration and scammed by the private health insurance companies. The Republican Big Bad Betrayal Bill passed in July of this year is estimated to kick 15 million Americans off their health care, with a massive $1 trillion cut to Medicaid. And in addition, the Republicans' refusal to extend the Affordable Care Act's tax credits will double and triple the cost of health insurance premiums for 22 million Americans, including that it will lead 5 million Americans to losing their health insurance by 2027. And that number steadily increases over the following years. We could well be in a situation in a few years where half of Americans are uninsured or underinsured. At the same time, the private insurance companies have figured out multiple ways to scam the current system to gain even more profits, from vertically integrating the clinics so that they can collect profits both at the insurance level and at the clinic level by forcing pre-authorizations by doctors who have been hired by insurance companies to pad their profits, and by continuing to raise premiums even as they take subsidies from taxpayers to those premium costs. With the cuts to Medicaid, rural hospitals are closing, and more Americans simply have no access to health care at all. On top of all of that, efforts to privatize Medicare through Medicare Advantage plans and increasingly restrictive provisions on seniors are being sped up under this administration. All of this is to increase the profiteering of health insurance companies at taxpayer pain and expense, so that the CEOs and the stockholders can get richer and richer while you pay more and get sicker. If there is any silver lining in all of this pain, it is that interest in a universal healthcare system is actually increasing. We can't just fight back against the constant attacks from Trump and Republicans on the healthcare that we currently have. We also have to rebuild our healthcare system from the bottom up, and out of the ashes of this destruction, create a system that actually provides comprehensive healthcare for everyone, from birth to death, when you need it, where you need it, not dependent on your job or your zip code. My Medicare for All bill with Senator Bernie Sanders is the only proposal for universal health care in all of Congress. We reintroduced the bill again this spring with 104 members signing on at introduction, and we are now at 106 co-sponsors, with the most recent being Rep. Shamari Figures from Alabama, who said to me that he got on because healthcare in Alabama has collapsed and you simply can't be, quote, too left on healthcare. My Medicare for All PAC has been doing new national polling, including oversampling in tough districts where candidates may often be reluctant to sign on to Medicare for All. We are so encouraged that there is a big opening this year to talk about our proposal for universal health care and to help educate people about what it is, how it can solve healthcare in this country at this moment, how much less it would cost Americans as a whole, and how much wellness it would produce. Because the American people are actually with us. But to do this, we really need your help. We have 213 Democratic members, and we need to increase the number of co-sponsors. To do that, they may need to hear from their constituents. They need to see organizing on the ground. city council resolutions advocating for Medicare for all, even local hospitals or associations of medical providers, or local unions pushing hard to come on board. Our numbers and our movement have grown because of your work. And now we have another opening, an opportunity to redouble our efforts and break through at a time when healthcare is so inaccessible and unaffordable to so many. Medicare for All is the only real proposal to transform our healthcare system, expand a very successful existing program so that it covers everyone and expands to cover everything, including mental, reproductive, dental, hearing, and vision care, as well as long-term care. It would, for the first time, put patients over profits. Despite all of the attacks from private insurance companies, it remains extremely popular, with the majority of Americans supporting it and over 100 cities and counties passing their own Medicare for All resolutions. But our polling also shows that the support can sometimes be fragile because the misinformation about Medicare for All is so high. People get worried by the attacks they see. Will my own costs go up? Will I not be able to see the doctor that I need to see? Will I end up waiting a long time for my health care? How does it really work? These are the fears that have been put into the minds of people. So our job is to alleviate those fears, make sure that people actually understand not just the slogan Medicare for All, but the actual way in which it works. Deeper education about the system and why it's important. That's our fight. Now, getting the legislation passed is going to be an uphill battle. We have to build support from the ground up. No matter if we're talking about state or federal single-payer healthcare, we are talking about the same principle, healthcare being a human right. State-based plans show us what can be done in the effort to provide comprehensive healthcare at a large scale, serving as a model for what a country with guaranteed healthcare could look like. They also give us momentum in our push for federal Medicare for All legislation. So as we collectively organize and mobilize for universal health care, let's keep fighting back against Trump's attacks on Medicaid and Medicare and for a healthcare system that actually works for everyone. Medicare for All is not just possible, it is so necessary. And you are the agents of change making that possibility a reality. So thank you all so much for your hard work, and let's go get this done.